It's Manu, Kalia, physical therapist and herbalist. So I'm going to show you another technique to help at improving the mobility of the upper back or your upper thoracic spine. So for those of you with neck problems, shoulder issues, with lack of mobility or better mobility or appropriate mobility in the upper spine, this is a good technique, and especially if you don't have a foam roller, tennis balls, or some other device to work at improving that mobility. All you need is the edge of the bed or table. So we're going to use this, and what I want you to do is I want you to make sure that you bend your knees. So what that does is it prevents you from hyperextending or arching at your low back too much. Okay. Now we're going to get to a point where I want to improve the mobility of the upper back. So let's say that it's about just below my shoulders, right? I want to make sure that the edge of the table is not by my neck, because I'm trying to target my upper thoracic spine. And the next thing you want to do is you want to support your neck. So I want both the hands behind your head, okay? So I'll take this hand off so you can see. So essentially, when my hand's placed here, I can work at supporting my neck, so I can place my neck in a slight dorsal glide position, okay, which is bringing my chin back, okay, gliding my chin backwards. So I'm not in a forward head position, because if I stay in a forward head position and I go backwards, right, I'm hinging at my neck again, and that's not the tissue I'm trying to target. So I'm trying to target it moving better through my upper back. So I'm going to put this in a slight dorsal glide position, double chin position as I'm supporting my head, right? And all I do is I let my head go backwards. So I might get to a point, and you're going to find that as you start heading back, the chin wants to come up. So do your double chin again, and then head back till you start feeling back in this region a stretch and some pulling sensation as you're working at improving that mobility, okay? Now I'll do with both hands as you're supposed to do that. So same thing here, and I head back, and I get to a point where I start feeling some stretching. I can hang out there at 5, 10, 15 seconds, just gently oscillate, stretch. You could even turn to the left, to the right. So you work at improving at different angles, and as I get better at it, I can go further and further and further, right? And now once I work at one segment, and remember, as you get more comfortable, you can increase the amount of time you hang out there. So then you might spend a minute and a half working at mobilizing that tissue or that particular joint and that soft tissue around that region. Then you might want to go to the next level. So I might go a little further, and then I would do the same thing as I head back and I stretch, okay? Come back out of there. So another reason to make sure is that supporting your head is so that when you come out of that position, it's a lot easier for me to bring my head back up and my arms are helping me, okay? So work at, start off about 15, 20 seconds, and as you get more comfortable with it, you can increase the time to minute and a half, working on mobilizing each segment in each of the levels, okay? Don't spend too much time. Don't crank on it too hard. Take your time in doing that and see how it feels. If you have any questions, leave a comment. Make sure you check out the site. There's lots of info on it. Thanks, guys.